So go ahead and hit play. Yeah. So I always let the patient know, hey, collarbone. Everybody knows about the collarbone, right? Clavicle. Above that, on each side, when you push in, the thing that stops you, that's the first rib. Tiny little bone shaped like this, not like this, but like this. That lives down in there. There are muscles that go from the first rib that go to the cervical spine. Those muscles are called the scalene muscles, right? The nerves that come out of the neck, they go between the scalene muscles before they go down the arm. If there's tightness in the scalene muscles, it can put compression on the nerve and can cause inflammation, pain, inflammation, tingling, numbness, weakness down the arm. It can also be painful just right in here. That rib can be elevated, which is kind of commonly what we see is a rib that's higher on one side than the other. So I'm coming in, putting pressure. Any pain right there, Tony?
No.
Now take a deep breath, deep, 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 super deep. Deep, deep, deep. There you go. So he's actually high on the left compared to the right. I don't know if the camera can pick that up, but he's a little high here. And so that's not tender compared to this one?
I feel about the same.
About the same. Sometimes there's no tenderness. So you can have some joint dysfunction without inflammation yet until, right? And again, usually where there's a restriction is not really where the pain is. The pain is going to show up somewhere near there because it's compensating for the restriction. So like for this though, like if I find an elevated rib, Johnny, on an eval, I'm going to ask you to come in and kind of do some soft tissue over it, and then maybe hold it down, and then go ahead and do a chin tuck for me, and then turn right and go as far as you can until you feel a good stretch. Ooh, and come back, and then keep that chin tuck, and then go right again. So now I'm trying to hold down the attachment or the insertion point, come back up where the scalenes attach, and go to the right. And then you're doing active motion to the right. You're trying to elongate those scalenes. And on my thumb, I can feel the pressure really increase when you get it right there. It starts to really increase. You should feel a stretch.
Yeah, I feel,
right?
I feel like stretch
Okay.
right around in here.
Yeah. So that's one way you can do this. You can have a patient do like 8 or 10 of those to stretch it. You can come in with a couple of fingers and just do a little circular kind of soft tissue mobilization over those scalenes. Okay. Then there's a strain, counter strain, right? You heard of strain, counter strain, right? So when a muscle's tense or hyper active, you can put pressure on that, and that puts a stretch to the muscle. Then you shorten the muscle, which relieves the stretch on the receptors, but you're still holding pressure. So there's a mechanical, you're kind of fooling the brain into thinking that muscle is at a good tension. So what I would do here, if I'm trying to relieve that tension, I would hold pressure. And a lot of times this will be tender or painful. And I'll take them, I'm taking you to the left to slack that, right? I felt slack happen. Then I'll tap back here and say, give me a push with your head. Push me. Oh, even more slack, right? Because I'm activating the muscles on the opposite side of the neck. So the muscles right there, the scalene where my other thumb is, those have to turn off so these on the backside right can turn on. Now relax. Good, just relax. Give me one more push. And relax. Good. And just try to rest. Totally rest. And you want to hold this for, I don't know, 30 seconds to a minute if you can. If there's any neck pain, are you hurting?
No.
Okay. And this just helps get that muscle to elongate and relax better, the scalene.
So if they do have pain,
this also can also help with pain. Yeah. So what will happen is if you push on it and it's painful, and then you do this technique, then you come back to normal regular position and push, the pain should be much less right there. A lot of times they'll say after you hold them for a while, you can say, is it pain or pressure now? And it's like, well, it's just pressure now, right? Okay, so that's first rib. You can also take an elevated rib, and with the same thing with the side of your MCP, you want to side bend toward the side to slack the muscles, and you can do some inferior mode. I'm kind of pushing toward here to get mobility in the joint. costovertebral joint. Okay, so that's some first rib. One more thing, I'll go ahead and cover this, is I talked earlier about just doing that range of that rotational in the upper T-spine, lower C-spine. But you can come in here to bilateral sides, and you can get down here to T1, 2, and 3, and just do a lumbrical kind of a grip or lumbrical mobility right here. Also to get some mobility in that upper T-spine. And I wouldn't do but about 10 to 15 of these. I wouldn't do a lot here. It's a lot of work, but you can do that. Go ahead and